everybody. It's been a hard day tending to my patients in the other room. I've got just a few minutes to talk to you guys about how this 1918 influenza epidemic has affected Clinton County. Now, I'm going to wait a minute for everyone to tune in, but then I got to get back to my patients. So, the 1918 epidemic, the flu epidemic, also referred to as the Spanish flu or Spanish influenza. Did you know that it actually didn't really originate in Spain? That's one of the first places that they found it, and one of the first places that news actually broke out about it. But it was all over the world, the country, our nation, by the time that it got the term Spanish influenza. So Spanish influenza was actually a result of germs. Germs that people did not have a immune system to or could protect themselves from. There was no medication for it. Similarly to what's going on right now with this COVID-19 outbreak, and people do not have that in their system to be able to fight it off. So first observed in Europe, the 1918 flu pandemic killed an estimated 20 to 50 million people and about 675,000 in the United States of America alone. No pandemic may occur, like I had said, without being immune and not having that immunity to this virus. That's how it spread so quickly. We were in the midst of World War I. As you can see, I have my wonderful nurse's uniform on to tend to my patients. But, you know, young boys were going off to war. They were confined in these ships and in these camps. And that's really how the virus got to mutate and grow. And then when they came back home from the war, they would spread it again to their families, their loved ones, and things like that. In 1918, there were actually two waves of the flu. One in early spring, which was somewhat mild and easily maintained, and then a second wave, which was actually stronger and worse in the fall of 1918, which lasted through March of the following year. The following information is taken mainly from Wilmington Daily News articles to share Clinton County's story and how it affected them through the year of 1918, and how it affected our people, our community, our businesses, and our doctors specifically. In September of 1918, news of the Spanish flu was often treated with humor, disregard, almost jokingly in the papers. In September of 1918, a news article actually ran stating that if you had the grip, as it was referred to, that it was as bad or comparable to appendicitis. Can you believe that? It says that this cold, as they refer to it as, is just a publicity stunt and not really something to be taken seriously. But Washington Courthouse was featured in one of the articles in the newspaper, which stated that there are 500 cases of Spanish influenza in Washington Courthouse, and that, jokingly, Washington Courthouse had to be the first of the first, the latest in fashion, the latest in gossip, and such on. So it states that being behind the times is worse than death with the people of Washington Courthouse. If it were more popular to have smallpox, and the smallpox were something new, then there'd be 99 cases of smallpox by the time that the victim was identified. But by the following month, in October of 1918, the newspapers were changing their tune. They were starting to say that Spanish influenza, the flu, should be taken more seriously. By October 1st, all of Main Building School was closed. The following remedy was published in the paper stating, now we know that medicine of the time was not the latest and greatest, but, you know, they did what they could, said, take a tablespoon of common baking soda, dissolve it in a half a glass of cold water, swallow it, and go to bed for 24 hours and stay there. Talk about a great cure to the influenza. Articles in the Wilmington Daily News lost their sarcasm when on October 2nd, it was announced that 41 soldiers had died of the flu at Camp Sherman, and that 251 cases were reported in Chillicothe, which is where Camp Sherman was stationed at. And Camp Sherman was a World War I camp where a lot of Clinton County young men went to serve in World War I. They were trained there. But 41 soldiers had died by October 2nd, causing the closing of schools, theaters, churches, and all public meeting places. On October 2nd, all Wilmington schools were closed. As I'm sure students right now are probably finding out that schools might not come back into session for the spring. So don't feel like you're alone. The children of 1918 experienced this as well. By October 4th, all public meetings are canceled. Church services are closed, much like they are now. And Wilmington city streets are closed to all but physicians. So we couldn't even go out in the street during 1918 unless you were a doctor. By October 5th, the Murphy Theater had closed. Subscribers are asked to use telephones only in the case of an emergency, illness, or fire. They didn't have enough people to staff the telephones to transfer phone calls. That's how sick people were by October 5th. Now remember, only a month ago, people were taking this as a joke. They were laughing, making jokes about the situation, but a month later, people are dying left and right. The Wilmington Daily News urges subscribers to be patient, that they don't have enough delivery boys to even hand out the paper. By October 7th, jury sessions are postponed until October 28th, and the public library is closed until further notice. By October 9th, Dr. F.A. Peel, the city health officer, had advised that doctors were too busy attending to patients to even comply with the state health department's suggestion to report the situations. They were too busy to even write letters to the state saying this is how many people have died, how many people are sick. They were too busy focusing on saving lives of Clinton Countyans. Further suggestions from the health officers were stated: avoid crowds and you are avoiding danger, much like we are doing right now with our shelter-in-place action. A lot of businesses were closing around the beginning of October 9th and following week. No crowds. They were encouraged, stay home, keep your distance, practice social distancing. And then sicknesses began to increase in Clinton County. Charles W. Murphy of Chicago, who you're probably familiar with the Murphy Theater, had postponed his plans to be in Wilmington on October 9th of 1918 due to the flu epidemic, and had said in a letter that he had received, that the editor of the Daily News had received on Tuesday of that month, that Mr. Murphy would not be coming to town. By October 10th, Harry Bath was a well-known local barber, began delivering mail to city routes. He was actually a retired mail carrier, but transitioned to becoming a barber. Well, much like they were talking about, Dr. Acton was talking about, pushing med students through school and bringing retired doctors out of retirement. Dr. Harry Bath was actually one of those that was called to serve in a mailman or mail person capacity. Dr. Eugene Murrell, he was up all night working on October 10th and had halted in the streets to give the Daily News reporter a word about the epidemic. And this is a primary source, and he stated that the situation in Clinton County was very bad, the worst thing I ever knew. Was the physician's first comments. I've had about 20 to 50 calls daily to treat sick individuals, and that an average of more than 40 to make for 10 days in 2 weeks. So doctors were just running around town trying to treat the sick as best they could, maybe providing that baking soda treatment that they had listed in the newspaper. But there again, an epidemic, there was no real cure to fight this. Another quote from a doctor, Dr. Morell, stated that people are hard to make stay in place, and that they need to take care of themselves even after they are well. That they basically need to rest, that they need to not go out of their house even after they've recovered from this illness. Dr. William Yopley, who you guys are probably familiar with through the article that we wrote for Black History Month in February, was the only Black physician in Clinton County, and he found many of his patients, he treated white people and Black people, and everyone was sick. It didn't matter the color of your skin. It didn't matter what you had in the bank, your pocketbook. It didn't matter how fancy of a house you lived in. If you were going to get sick, it didn't matter your race or your beliefs, you were going to get sick. And a speech that was actually given in Washington, D.C. by Reverend Francis J. Rimke around this time was actually stating about how, in his opinion, this pandemic was a statement from God saying that you have to stop putting races against each other, or the poor versus the rich, that this illness was going to get anybody that it could, that being whoever you were was not going to stop you from getting sick. When the Wilmington College closed in early October to students, much like our schools and our colleges are now closing as a result of this current pandemic, Mary Mills had provided a first-hand count experience that we'd like to share with you. She had wrote that the college pupils have been hit by the influenza epidemic. Nothing is normal here. Schools, theaters, and all public gathering places are closed. Those who have already died held private services. Physicians are all dreadfully overworked, scarcely sleeping or eating. Nearly every family has at least one member who is ill, and many in families, all people are ill. It says, I went this morning to the little home of a man who cleans the streets. He and his wife and family, 10 children, live in a home in 3 tiny rooms. His wife and 2 of his children are sick in bed. More likely than not, they would go on to pass away. From the History Center's archives, we do have some flu records, the 1918 epidemic and pandemic, in our archives that you guys could stop in and see when we do reopen, because we are currently closed. But we do have a list of approximately 40 Clinton County doctors who were serving during the 1918 epidemic. They included George Austin, F.A. Batten, W.J. Dudley, Janice Fisher, William Hale, D.V. Ireland, J.H. Norman, Frank A. Peel, William T. Scott, Elizabeth Shreves, Harry H. Suntz, Clayton A. Tibbett, George W. Wire, George W. Wood, and many others. So that's just an approximation, about 40 Clinton County doctors. But unfortunately, because they were treating the sick, some of them did perish as a result of contracting influenza. A small timeline that we do provide at the History Center on the pandemic, I'd like to read to you guys and share kind of what was going on in Clinton County when this influenza was striking our community. As I had mentioned, on October 2nd, all Wilmington schools were closed. Adams Township and Mount Pleasant schools closed. By the 4th of October, over 4,000 cases and 100 deaths were seen in the state of Ohio. So as you guys are tuning into these COVID daily updates with our governor and Dr. Acton, these numbers are going to probably rise. By October 4th of 1918, 4,000 cases, 100 deaths in Ohio. October 5th, influenza had hit the news journal staff, and they had to eliminate content to keep up with the schedule, and deliveries were impacted. Telephone notices went out that you should only be using the phone if it was for an absolute emergency use. On October 7th, the Wilmington Public Library closed. On October 8th, the following day, the Clinton County Telephone Company requested emergency use only. On the 9th, Dr. E.A. Peel had reported that the situation was so dire that they could not report to the state health agency. By the 11th of October, Ohio was hit hard by the influenza. More than 40,000 cases and approximately 800 deaths reported. By the 12th, help was wanted at home. State health authorities considered requesting physicians and nurses from Middle West states to help treat the 50,000 cases that had developed in Ohio. By that same day, influenza had struck Blanchester, and 3 caskets were, there was a funeral for 3 family members in the same home. Fred Myers, his wife, and daughter, 39, 34, and daughter Mary Ann was 10 years old. And they are all buried in Sugar Grove Cemetery. Highland County that same day had lost many citizens to the raging epidemic. By the 15th, nurses were wanted by the Red Cross. So a similar outfit to this would have been worn by the women of the Red Cross to serve those patients that were most dire. By the 18th, schools and churches are remaining closed. Physicians are now being reported ill by the 19th. Blanchester's Dr. Baldwin, Sparkick, and Normand and Martin were all ill. By the 22nd, one Blanchester doctor, Dr. Normand, at 67 years old, had died of pneumonia, which was often a common symptom. You had, beat the influenza, but then developed pneumonia as a result. The deaths at Camp Sherman had totaled over 1,000 soldiers. Xenia had an epidemic in a light form that only 150 cases were reported. And that in October 23rd of October, a ban that they had suggested lifting, restrictions, you couldn't go out of your house, similar to now, was discussing being removed, and it was decided that it would not be removed. On the 25th, 6 deaths at Camp Sherman, and a death toll of 55 people in Clinton County on October 25th was stated. On the previous day, the 24th, a curfew was enacted by the health officer, F.A. Peel, and this curfew was for children 16 and under. They would notify you of the curfew by ringing the fire bell at 7 p.m. every evening to tell you to go back home. By October 29th, health officials gave advice to rural people. So, relating to Clinton County and our farming roots, Dr. Peel and J.H. McKenzie, health officer of Chester Township, urged farmers to take precautions to limit the spread of flu during corn shredding season, which was now beginning. Doctors advised against crowding in small rooms, to take meals, to take your dinners with you and eat in the open. By November 4th of 1918, schools were going to become reopening. So theaters were open going to be open on Friday, but 16-year-older, you had to be 16 years or older to enter the theater after that quarantine was lifted. Stores were going to close at 6 p.m. each day during the week, and then 10 p.m. on Saturdays. Pool rooms were going to remain closed. Churches could hold Sunday morning services, but the library would remain closed. So kind of a back and forth between in Clinton County, are we reopening? Are we staying closed? How can we best protect our people during the 1918 outbreak? By November 5th, Jamestown, kind of on the cusp of technologically advanced, they were actually mailing their homework to students, and then students were mailing it back. So Jamestown, that's pretty interesting, and I did want to point that out. I thought that was pretty cool. By the 8th of November, Blanchester had lifted their restrictions on public meetings, and that people were allowed to begin meeting again. The library had reopened by the 11th of November, and by the 21st of November, Chester Township schools were reopening as well. But unfortunately, by November 27th, influenza had rebroken out in Clinton County and was reinfecting our community and our people, our doctors, our businesses, and so on. The paper stated alarming news, reports breaking that an apparently more violent and more prevalent than the case of its first appearance some weeks ago, influenza had returned. Port William schools closed. Sabina reported 50% of their students were not in school. 4 cases were reported in Hawes Chapel. Gurneyville and the vicinity was affected again, and so on. So unfortunately, it came back to Clinton County even after the precautions that were taken. One thing I thought was funny to share with you all regarding Charles Murphy and the Murphy Theater was that on November 27th of 1918, he had reported to the paper stating, "We spent thousands of dollars for a wonderful heating and ventilating plant, and no microbe can live in that ever. That bacteria are also barred from the Murphy Theater." So a little plug for his theater. I'm sure he was trying to advertise that because I'm sure his sales were down, but claiming that the heating and ventilation was the best of the best and you couldn't get sick by going to the Murphy, which we probably have learned that that's not necessarily true. By December 7th of 1918, kids were out in the streets. They were playing much like they're playing now. The Board of Health of Blanchester unfortunately had enacted that kids were not allowed to be outside, that they had to stay inside after they were found caught playing outside in December. So that was reenacted, that you were not allowed to go outside, you needed a shelter in place, you needed to stay at home. By the 11th of December, a notice to the public, all sales and public gatherings of whatsoever character are prohibited during this period of prevalence of influenza in Wilson Township, Clinton County. So the Board of Health enacted another restriction that you were not to be going out because of the second wave that hit our community. By December 14th, all of Clinton County, all of Wilmington was shut down again. So December 14th, we go back into quarantine, but by the 17th, just a few days later, they felt like that quarantine was enough to prevent more sicknesses, to prevent more deaths, and kind of slow the spread. So conditions were justified that the health board removed all restrictions of quarantine. A personal story, an account from Camp Sherman servicemen I'd like to share with you all. If you guys know Susan Henry, she sits on our board and is the president of genealogy. Her great-grandfather, Charles R. Starbuck, was a service member in Camp Sherman when the Spanish flu and the 1918 epidemic broke out. It states, in 1918, Wilmington native Charles R. Starbuck was stationed at one of the new World War I training camps called Camp Sherman. In late summer and early fall, the influenza arrived at Camp Sherman, taking the lives of nearly 1,200 soldiers in its wake. Camp Sherman was under quarantine. No one could leave, no one could come in, no one could go out. Back in Wilmington, Esther Doan, who was his fiance, waited for Charles, wondering when and if he would ever return to marry her. On November 9th of 1918, the quarantine was finally lifted from Camp Sherman, and Charles R. Starbuck arrived on the doorstep of the Doane family home on 5th Avenue. A wedding was held that day. As you could imagine, I'm sure they couldn't wait. And the armistice signed for World War I 2 days later. This was provided by Susan Henry from our records. And I want to take a moment to encourage you all who are listening and watching today, who might be watching this later on with your families. We are living through history right now. As scary as that is, or mind-boggling, or astounding as that phrase might be, we are living through history. So, the actions you take today, 50 years from now, 100 years from now specifically, will be looked upon. And what were they thinking? What were they doing? Kind of what was going through their heads, like we're thinking now. What was going through an individual's head who was affected by the 1918 epidemic? So, I'd like to take a moment to encourage our viewers, our followers, and our membership to please document what is going on in your lives right now with this COVID-19, this coronavirus outbreak, this pandemic that we're living through in 2020. Your diaries, your firsthand accounts, your primary sources that you might record are going to make all the difference when it comes to history, when it comes to local history, to knowing what was going on in Clinton County in 2020. So I want to encourage you all to take a moment to maybe start a diary. That might be a great project for you and your family, your kids, your grandkids, to start a daily diary. Just record what's going on in your head, in your family, in your community, and how these acts by the governor and our nation and just all these restrictions that are going on, how is that affecting you? And just like Mary Mills, just like Charles Starbucks, just like Dr. Yoakley, you can be a story in history. So I want to encourage you all to do that. So with that is our daily COVID-19 history update. Thank you guys so much for tuning in. We hope to continue doing our Facebook Lives, and we're going to do a couple different topics. We've got with the 100th anniversary of the 19th Amendment, women's right to vote, you're going to be seeing me in a different outfit for that one. But please tune in and maintain and follow on our social media on Instagram and Facebook just by searching at Clinton County History. As a reminder, our museum and our genealogy library at the History Center are currently closed. They will be closed until further notice just due to the COVID-19 outbreak. Our volunteers are not available to come help us. We've got this shelter in place or this stay-at-home act going on. So I encourage you guys just stay safe, stay healthy, and remember that you're living through history right now. So take the opportunity to document what's going on in your lives so that in 100 years from now, we can remember what was happening in Clinton County in 2020. So thank you guys so much for tuning in. I got to get back to my patients. I got to take care of them. Nurse Shelby here. But have a great afternoon, guys. I'll talk to you later.